During a supervisory visit to an immunization session, you observed that a health worker has forgotten to tell caregivers about possible adverse events that may occur. If you do not address the situation by providing effective feedback, she may not recognize the problem and the impact it can have on children's health. As a district or subnational manager, you provide both positive and corrective feedback to people you supervise. But how you give this feedback can make a big difference to the success of the staff and the overall program. When done well, feedback can help motivate health workers to improve their knowledge and skills. When not done well, feedback can leave staff feeling frustrated or confused and can even have a negative impact on performance. Here are a few key strategies for providing constructive feedback. Begin with positive feedback. Identify the specific behavior and its impact. Ask questions to understand the reason for the behavior. Provide a clear solution. Give feedback as soon as appropriate and focus on a few key behaviors. First, begin with positive feedback before giving corrective feedback. When you begin by recognizing good performance, the health worker will feel valued and will be more open to corrective feedback. Be specific with positive feedback. Instead of saying, "Well done," you might say, "You talk to mothers with compassion." This is more likely to reinforce the positive behavior. If the positive feedback is not immediately obvious, focus on an improvement from your last visit. Next, identify the specific behavior you observed as well as its impact. When explaining the problem, be specific and focus on behaviors you observed directly. For example, you would say, "You have not informed the mother about adverse events following vaccination." You may need to state when and where you observed the behavior so they have a reference. Avoid using generalizations such as always or never. Also, focus your feedback on the behavior, not the person. You might remind someone to be more careful to remember something, but you would not call them forgetful. Once you identify the behavior, emphasize its impact. Why do their actions matter? Does it have an impact on patient safety? The success of the immunization program? You could explain, if mothers do not know that side effects are normal, they may think that vaccines make children sick and may not return for vaccination. If a health worker understands why a behavior is important, she is more likely to change or improve her performance. Then, ask questions. When giving corrective feedback, ask why to understand the reason behind the behavior. Is it a lack of skills? Or are there challenges that prevent her from doing something correctly? Ask questions to better understand what the person already knows. For example, what are key messages you give each mother after vaccination? When feedback is a conversation instead of a lecture, the person will be more open to change. Next, provide a solution. If you identify a mistake, do not just focus on the problem, offer a clear solution. What should they do differently? When possible, work together on the solution. When health workers are part of the solution, they are more likely to carry it out. When a solution requires a new skill, be sure to describe or demonstrate the correct behavior. For example, demonstrate how and what to communicate with the caregivers during an immunization session. Then ask the person to practice or describe it back to you. Remember that the objective of your visit is not just to identify problems, but to help solve them. Always give feedback as soon as appropriate. When possible, give feedback right away, in the moment you observe the behavior. Feedback will have more impact the closer it is given to the actual behavior. However, at an immunization session, it is best to give corrective feedback in private unless a child's safety is at risk. You should also wait to give an individual corrective feedback in private rather than in front of other staff. And wait to give positive feedback until you're in front of the staff. A good general rule is to praise performance in public and correct mistakes in private. Finally, focus your feedback on a few key behaviors. Try to limit your feedback to 2 or 3 issues. People are more likely to change their behavior when you do not overwhelm them with too much feedback. If staff is performing poorly in many areas, you will need to prioritize the most important issues for them to focus on. For example, you may have them focus on communicating key messages and defaulter tracking over the next month before working on other areas of improvement. You should now know some key strategies for providing constructive feedback.